Welcome to our Nz-Osce learning session. Today we will go through Station 4, Professional Responsibility. In this station, you will be assessed on your ability to provide culturally safe care while respecting the patient's values. You are also expected to maintain a therapeutic and respectful conversation throughout the interaction. Please read the scenario carefully for 2 minutes. In this scenario, you are a registered nurse working in the preoperative surgical ward of a public hospital in a morning shift. You have to identify your patient name, date of birth, and NHID. She is scheduled to undergo laparoscopic cholecystectomy at 2 p.m. Her cousin is with her. She has already signed the consent form for the surgery, but now she has some concerns. She reports that she has no symptoms like pain or discomfort that would suggest no need for surgery right now. She explains that her family was not present during preoperative explanation of the procedure, which makes her feel uncertain about the decision. Her medical history revealed she has a history of gallstone but no significant symptoms. The surgeon recommended surgery based on imaging findings and potential future complication. Her cultural background revealed her family placed significant emphasis on family involvement in healthcare decision making. They value a holistic approach to health where both physical and spiritual well-being are important. And now she feels uncertain about the necessity about the surgery and uncomfortable with the idea of undergoing the procedure without family members being involved in her decision. She feels disconnected from the procedure and her role within her family. In this scenario, your task is you have to introduce yourself and establish a rapport that should clarify her concerns and advocate for her well-being, and you have to ensure culturally safe communication involving her family, and you have to document it in her clinical notes. So this is the scenario for the Station 4. Let's start. As always, knock the door before entering the room, and you have to look for scene safety and always try to ensure privacy by closing the door. And you have to perform hand hygiene. Simultaneously, you have to start introducing yourself and you have to verify your patient. In this station, you have to place importance on their cultural sensitivity. So consider using culturally appropriate greetings such as Kia ora instead of good morning to maintain a therapeutic, respectful conversation throughout the scenario. So shall we begin? Kia ora. I am so and so. You are assigned nurse for this shift. How may I address you? You may call me so and so. I know that you are posted for the surgery, right? I heard a call bell from your room. Is there any concern I need to be taken care of? Or is there any concern you would like to me to address? Yes, nurse. I am scheduled for surgery or I am posted for surgery, but I don't know. I don't have any symptoms right now. Then why should I consider surgery right now? And moreover, a friend of mine told she didn't go through surgery for the same. Yes, I can understand your concerns. Before moving further, is it okay if I am sharing information in front of your cousin? Okay, sure, you can discuss or you may discuss it right now. Could you please show me your wristband for before confirmation? Yes, here, sister. So like that you have to introduce and you have to verify your patient. Then once they started to express their concern, as always, you have to empathize, then only you have to provide appropriate suggestions. Here you go. That let me explain in detail. Regarding your surgery, it's based on the radiological investigations that has been confirmed that surgical intervention is appropriate for you. If you are delaying it, it may lead to potential complications. Am I clear to you? Okay? I understand, nurse. But nurse, I was alone while while discussing about my surgery, and I need my husband or my family to be known about my condition. So you have to reply like this. Oh, that's really great. I totally respect your need to involve your loved ones, or I really respect your culture and values. Thank you for sharing that. I completely understand and I truly respect your values and the importance of family support in making healthcare decisions. Would it be okay if you let me know when they arrive? Or it would be fine if you could let me when they are available. I will schedule a meeting with your doctor, or I will arrange a meeting with the doctor so everything can be explained clearly when they are here. How does that sound to you? Okay, that's really grateful, doctor. My husband is on the way. They should be here in about an hour. Thank you so much, nurse. I feel so much more at ease now. Like that, you have to maintain an appropriate therapeutic conversation. Once they address their concern, you have to empathize, and then only you have to provide appropriate suggestion. Again, we have to initiate your conversation like, do you have any other concerns that makes you upset? Then she is thinking and saying that, are there any legal issues if I didn't go for the surgery? I already signed and given my consent for it. I'm really upset now regarding that. We have to say that no worries at all. It's completely up to you. You have to promote the patient right. They have the full authority to take decision regarding your treatment or any type of surgery or any type of procedure. So you have to give more importance to, you have the full authority to make decision regarding your any kind of treatment. Am I clear to you? Or is that clear to you? So once they addressed, you empathized, then you given recommendations. Moving further. Nurse, how long I have to stay here after surgery? I have 4 children. My parents are also sick, or my parents are also unwell. Then again, that's really a sensible concern from your side. I can understand your situation. Usually, for laparoscopic procedures, it allows for the same day discharge. Within the day itself, you can move on from here. But however, it ultimately depends on how well you are responding to that procedure. It totally depends upon that. Am I clear to you? Again, regarding your family, could you ask help for your friends, or do you have any neighbors or relatives nearby? So your children's and parents are taken care of. Is there anyone else to support you? No, sister. Anyway, one of my friend is there with me. No one else is there to support me and my family. Could you arrange an alternative method or alternative measure for that? Definitely, I can help you for this by saying, here we do have a social support system. If you are allowing, they will support you and make sure your family or your children or your parents are safe and well cared of. or you can say that your family are looked after very well if we are allowing to do so. That's really helpful, sister. If possible, I would like to suggest you that if possible, could you arrange a Maori social worker for the same? Sure, why not? If you are asking for that, if you are requesting for that, definitely I will ensure that Maori social worker will look after your family. How does that sound? That's really great. I'm very thankful to you, sister. Sure that you ask the patient if they have any other concerns that need to be addressed, and continue the conversation until they confirm that there is nothing further to discuss. So you have to ask like this way, do you have any other concerns that need attention? Until they confirm that, no sister, there is nothing, thank you nurse. Okay, that's great. You have to take adequate rest even after the surgery. Okay, I will ensure continued care from as you requested for Maori social worker even after your surgery. If you have any other concerns, please feel free to contact at any time here. We are here to always support you. Please press the bell once your family arrives. I will arrange a meeting as early as possible. Okay? Thank you. In this station, you are required to complete a clinical note accurately and professionally. Your documentation should include the patient's name, the reason for the surgery, the concerns raised by the patient, and what all suggestions or reassurance or support you provided or you offered for that patient, with a proper conclusion with your name and signature. Okay? Like this way, I attended to Mr. or Mrs. So-and-so who is scheduled for dash. The patient shared concern regarding upcoming surgery, the absence of family in decision making, inquired about legal implications, and anxious about family well-being. I reassured her about the importance and benefits of surgical intervention and provided education on patient rights, offered a Maori social worker for cultural support. Moreover, I scheduled a meeting with surgeon to clarify her doubts. And by mentioning your name and signature, then only you have to conclude that clinical notes. So that's all about our station 4 professional responsibility.